Hi everybody. I'm so excited for tonight's live. We have such a mix of questions tonight. I think we're going to cover a lot of different things. Hi Mohit, hi Tatiana, I'm so happy you're here. Hi Kathy, I'm so happy you're here. Poonam, I think I just got a message from your sister, but it was in my request, so I will get back to her. I didn't see it. Teresa, I'm glad you can make it this week. Oh, we haven't seen you in a little while. I'm so happy you're here. We have so many great questions this week. Can everybody hear me okay? You guys can hear me? I'm trying the AirPods out this time because I think last time there was a blip. So if you can't hear me, just let me know. Hi, Dr. Sadek. Okay, great. I'm glad you guys can hear. So this week I kind of left it open to ask any questions. Thanks, Poonam. So we got a bunch of different questions. A lot about Botox and fillers this week, so we're going to focus on that a good amount. We also have a lot of questions about skincare. We got some great questions about men's skincare. Maddie, I love your question about how men can age gracefully and how to keep their routines a little simpler. Some laser questions, some body sculpting questions. Really interesting questions actually this week, so I think we'll just get started. And if anyone has any live questions, again, the reason I'm here is for you guys. I love Monday nights, so feel free to send in a question. I have my notebook ready, so if I'm answering a question already, I will write it down and get back to it. And here we go. So the first question I got was, what do I think are the best at-home chemical peels? I love this question because a lot of chemical peels, when you look it up online, are ones that you can get on Amazon that should actually be done in the office. Half the time they're not even the real thing. And if they are, it's not safe to be doing it at home. So a lot of my patients ask me, I would like to do a chemical peel regularly at home. What can I do? I have 3 favorites. So when you're looking for at-home peels, you want to look for glycolic acid, lactic acid, or citric acid. Those are your AHAs, and then that stands for alpha hydroxy acid. And you also want to look for potential beta hydroxy acids, which would be your salicylic acid. So my favorite one to do at home would be the Drunk Elephant Baby Facial. A lot of my patients already know that. It's one of my favorites. It really does brighten up the skin. It has 25% AHA. It's a mix of glycolic, lactic, and citric. And it also has a 2% BHA, which is salicylic acid. So that does a really nice job of shrinking your pores, just shedding off that dead skin cell layer that kind of sits on our skin and gives us a duller look. It's not inexpensive. I think it's $80 on Sephora, but it does last you a while. And you don't want to be doing this more often than once a week, twice a week tops if you're not using an exfoliating wash throughout the week. This is more to be viewed as a peel at home rather than something you do every day. Afterwards, you absolutely want to moisturize with a thick moisturizer. I think they include marula oil when you buy it, which is a nice, thick, oily moisturizer. If you have acne, you don't want to use that. You want to stick with a non-comedogenic moisturizer afterwards. And I love that one. That's probably my number one. I also like the Glytone. Glytone makes one called Rejuvenating Mini Peel, and that's glycolic 10.8%, which is an AHA. It's nice, it's easy. You can definitely do that one about 2, maybe even 3 times a week, but 2 is what I usually stick with. It works, it brightens you up, it shrinks your pores, and it's a nice at-home addition to your skincare routine. And the third peel I recommend to people is Paula's Choice. There's one that advertises that it's 10% glycolic, but the main reason I like it is actually the other ingredients in it. There's green tea, vitamin C, and resveratrol in there, which are really potent antioxidants. Hey Trista, hi Joe, I'm so happy you guys are here. Oh, it's so good to see everyone here. And Tiffany, hi. So Sarah, I got your questions, I'm answering them now. We're answering the peel one right now. So I like that one because it's infused with antioxidants. So it's definitely going to be more of a glowy type of peel. It gives you a brighter look. The 10% glycolic is awesome, but that one I like a lot more for the other ingredients. Those would be my 3 favorites. I mean, I can list a lot of other ones I think are great, but that would answer my favorite best at-home chemical peels once, twice a week tops, in addition to your skincare routine. So if that doesn't answer your question, let me know, and I can send you some other ones, but those would be my favorites, and you can get them all online at Sephora or on the individual websites. I wouldn't get them on Amazon. Anything that's you're going to put on your face, given a few exceptions, I'd rather you get on the direct website or on Sephora or at the doctor's office. We do chemical peels in the office as well. They're much stronger. Anything that says in-office use, you definitely don't want to do at home. There's a reason that it's done in the office, and you can definitely hurt yourself or cause hyperpigmentation and darkening and scarring, and that's the opposite of what you want to do. Great. So if nobody has any live questions yet, we'll go on to the next question I got over the past 24 hours. So I had a question: what is better, Dysport or Botox? So Dysport and Botox are in the same family of something called neuromodulators. These are injections that we do in certain areas to help stop making certain facial movements or soften certain facial movements to minimize wrinkling. They help with wrinkles that you make when you're moving your face, like around your eyes, when you're frowning, when you're raising up. And they help to minimize how much of that face you can make so that the lines don't set in. So I've done Botox recently on my glabella, so I actually did maybe a little bit too much, so I can't really bring my eyebrows any closer together than this. It's a little more than I like. Usually I like to bring them a little bit closer together. Happens sometimes. And they're all different in the size of the molecule, how quickly the onset is. It doesn't happen right away when you get the injection at the office. It takes a few days, up to a week, sometimes up to 2 weeks to kick in. How long they last and how your body responds to them. I don't necessarily have a favorite. If I had to choose between Dysport or Botox, given the question, I'd probably choose Botox because it's a little bit more specific. But Dysport is great for certain areas of the body as well. There's 2 other toxins we know about. One's called Xeomin. I love Xeomin. If I had to pick my all-time favorite, it would probably be Xeomin. And Jeuveau, or Nutox, is the newest neuromodulator on the market. They're all a little different. Everybody has their preferences. I like Xeomin because it's the smallest molecule and it has it's least likely for you to develop antibodies, which means it doesn't work for you anymore. And that's not just for cosmetic reasons, but there's lots of medical conditions that neuromodulators treat, so it's better if you don't develop any sort of antibody because, God forbid, you need it for a more medical condition, you want it to still work. So if I had to pick my number one favorite, this is all obviously just my honesty, I would probably go with the Xeomin. I like Botox, I like Dysport, I like Jeuveau. I would probably go maybe in that order, I'm not sure, but that would be my answer, to give you an honest answer. Everybody's different, it depends on your anatomy, it depends where you're putting it depends how much diffusion we want, it depends if you'd like it to kick in a little faster, or if you're okay with a slower onset and a longer lasting product. It's all about your doctor to kind of go over that with you, and you can make the decision together. For jawline contouring, do you prefer using neuromodulators or filler? I've read that both are used. Great question, Tiffany. So actually the next question we got is, how can I make the back of my jaw look stronger? So I'm going to answer both questions at once. So for jawline contouring, jawline contouring is a great way to put it, rather than saying, to make it look stronger. I love the way you phrase that question. Jawline contouring is something we do a lot of. We did a lot just last week. I probably use a combination of both. It depends on the goal and what you want to look like. So if you're somebody who has really strong masseters, these muscles right here, when you bite down, a lot of people want a slimmer lower face. It's a more feminine look in a lot of ways, although I do think a contour jaw looks nice, but just a smaller, more of like a heart-shaped face as opposed to a boxier jaw. I use neuromodulator into that area to help weaken that muscle so that this area gets smaller. It's also really helpful if you grind your teeth or if you have TMJ. It's something that really helps with those symptoms. So I do use neuromodulators in that area to inject that muscle. You need to see a dermatologist to do that. If you mess up and inject into the wrong area, you might not even be able to smile, and that's a mess you don't want to get into. So we do a lot of that where we inject Botox here. However, most of the time when it is for jawline contouring, I see people who want to have a more defined jawline, in which case I do Botox into the neck, which is called the Nefertiti lift. So I have these bands that happen. We inject those. They're called your platysmal bands, and that helps give a nice lift to the jawline. Botox has also been shown to minimize the appearance of very fine lines or crepiness in the neck, so I also inject superficially around this area. And then in addition to that, to contour the jawline, I'll do filler into the back area here and sometimes even line it all the way through depending on the anatomy of the patient. Thanks, Lois. That's such a nice compliment. Hi from Ghana. It's so cool. I'm glad you're here. So we do what we call something that's going to help lift the area by relaxing the Botox by using the Botox to relax these muscles while adding filler into this area to help give a stronger look, like the other question got in the back of the jaw right over here. I like Radiesse or Voluma in this area, or Sculptra, because it really does give a bonier look to that area. You want it to look more like bone. We just had a beautiful result just last week on Friday, actually, for this area. And a lot of the time when we are making this area look stronger, we also accentuate the cheekbone to give it more of a sculpted look. But it's usually a mix of both. If it's just wanting to weaken the muscles and slim the bottom half of the face, we'll do the Botox or the neuromodulator into this area. If you want to give a lift as well, you do the Nefertiti lift. If you really want to make a stronger look or a more tapered look to the jawline, or more defined look, I should say, it's a combination of both. Both alone will also help, but together they work the best. I love that procedure. It looks great, and we do it a lot. I hope that answers your question. If it doesn't, Tiffany, let me know. And Christina, I think you asked about the back of the jaw. So if I didn't answer your question, let me know. The filler into that area is really nice, and it's very specific, and it's a beautiful result. Great. So, and the filler also will lift up because it'll pull up. So it's a nice addition to the lift. Okay, so that's 2 questions answered there. If anybody has any live questions, again, welcome. If you guys are here, feel free to send them in. Oh, great, Tiffany. I'm glad I can answer your question. And I will go on to the next question we got online in the past 24 hours. So we got a question, can I treat rosacea with lasers? Absolutely. So rosacea is redness of the face. There's different types of rosacea. There's erythematous-telangiectatic, there's papular rosacea, there's granulomatous rosacea. There's different types that happen, and mostly just kind of the center of the face. Do you recommend any moisturizers besides one from Elastin? Yeah, actually somebody else asked that, so I'm going to go through. I have them right here to show you which moisturizers I like. I'll get to that in just a second, Teresa. So rosacea is essentially a multifactorial condition. It's redness of the skin. It's really leaky blood vessels in this area, very superficial blood vessels that leak. Literally, there's some excess of the blood vessels, and that causes inflammation in the area, which can lead to bumps or flushing or thicker skin. And lasers can be used to actually target the vessels specifically that are causing this disease to help alleviate the symptoms. Usually it's in combination with the topical routine that your dermatologist will go through with you. However, if you want more of a definitive treatment that lasts longer, getting rid of those vessels is incredibly helpful. We use the XLV laser in my office. We can also use something called the PDL laser, which is a V-beam laser. Most lasers that target, hi Amelia, I'm so happy you're here. We were just about to go over some Elastin moisturizer and some others. You target the vessel. So the laser targets the red, the hemoglobin, the red is the target. If you look up how red lasers work, you can actually even see there's lots of cute videos where there's a clear balloon and then a red balloon inside, and the laser is put on the outside and zapped, and the clear balloon stays intact while the red balloon in the middle pops. So it shows that the red is really the target. It takes a series of treatments to get you to a point where you're happy with the rosacea, but it does work, and yes, we do it all the time. You can definitely use lasers to treat rosacea. That's a great question. And I have the oily hair question as well, so I'll get to that too. So Teresa, since your question just came in first, do I recommend any other moisturizers besides Elastin? I love that you asked that. Everybody knows that the Elastin Ultra Nourishing Moisturizer is my favorite one because it's full of antioxidants, it's gentle, it's non-comedogenic, it's paraben-free, fragrance-free. It's awesome, and it works. So I love this one, but there are other moisturizers I do like. So if you want a hyaluronic-based moisturizer, one of my favorite ones is the Skin Medica HA5. It is quite expensive, so you get a lot more bang for your buck with the Elastin one, but I like this one for hyaluronic based. I like the Neutrogena Hydra Boost Gel Cream, not the water gel. I like the gel cream. It's full of hyaluronic acid. There's no antioxidants in there like the Elastin one has, but it's a great just everyday moisturizer. And I really do like, I wonder if I have it in here, I think I finished mine recently in the winter. My winter moisturizer for a bit of a thicker moisturizer, I like the First Aid Beauty Ultra Repair Cream or Hydra Firm Sleeping Cream. Oh, Teresa, look at you. You're a pro. You have the best stuff at home. So I love the First Aid one, especially if you're acne prone. It's non-comedogenic, it's clean, and it works really nicely. It's thicker, so it is my winter moisturizer, especially if you're using a retinoid, but I think those would be my favorite ones. Hope that answers your question. Hey, Bridget. Oh, great, Teresa. I'm glad you have that too. Bridget, it's good to see you here. We have a few questions that I think you would be able to answer at this point. Okay, so that answers that question. And we will keep going with the questions we got for the past 24 hours. Oh, the oily scalp and dandruff that we just got. So for oily scalp or dandruff, if you have a thicker flaking and oiliness, you want to see your dermatologist. A lot of the time that's something called seborrheic dermatitis, which is a condition that can be treated with prescriptions. If you don't want to go straight to the dermatologist, I recommend trying antifungal shampoos like Nizoral shampoo or Selsun Blue, or anti-dandruff shampoos, actually, that's the same thing. Those help to shut up that flaking and help keep the area more like a normal scalp. But typically that is something that we can prescribe drops for and we can help out with so that you're happier with how the hair and the scalp looks. And you can lose hair actually from significant dandruff, so it's important that you come in. Oh, Savannah, yeah, the first aid one's wonderful. See, told you they're good. It's not just me who thinks so. It's good to see you here, Savannah. Can't wait to see you soon. I look at your name on the schedule. I know when you're coming. Okay, we will keep going with the questions from the past 24 hours. Hey, Taryn, thanks for joining. And if you guys have any live questions, again, feel free to send them in. I love answering them live. So I got a filler question, actually. This might be the first one we're answering tonight. Yeah. What is temple filler and should I get it? Oh, Miriam, good. I'm glad I answered the question, so we have to chat. So temple filler is something that I don't think is discussed that often. Miss you too, Savannah. But it's something that's so important to incorporate if you are having filler done. So our temples are an area where we actually lose a significant amount of volume as we get older, especially people who exercise a lot. It's one of the areas where you lose fat. And it's defined in the beauty industry and dermatology and studying, the symmetry of the face. This area is the C curve, and it's important to have this area filled as a sign of youth. If you think about it, that's the heart-shaped face. That's a youthful look. As we get older, everything starts to go down. So you want the temples to continue to be smooth. A lot of people like that indented look where the cheekbone juts out because it's like a sexier look, and I guess it is, but it is more of an aged look. A more youthful look is to have this area filled. And having your temples continue to stay full actually will make your eyes look bigger. And will help soften the appearance of crow's feet. So I love temple filler. Anytime I'm filling the upper cheekbone in any of my patients, I also fill the temple. I think it's incredibly important. Especially a lot of my patients are runners or athletes, and that area tends to lose volume early and quickly. So we definitely replenish that, keep the eyes looking nice and open, contour this area of the face, mix it with a little bit of neuromodulator in the forehead to really open everything up, and it's a beautiful result. So I love that question. That was a great question. No one's asked that yet in the past few weeks. Hope that answers that question. If I didn't, just let me know. And which type of filler I would use depends on the person. Usually it's Voluma, Sculptra, or something like that. I got a question. So we did the rosacea. Can lasers be used to treat warts? So that was a great question too. We never talk about more medical stuff, so I'll answer it. Yeah, you can. Typically we treat warts with a lot of other things before we go straight to lasers. There's lots of other options to treat warts. We treat them all day: liquid nitrogen, trichloroacetic acid, cantharidin, Candida injections, 5-FU injections. There's lots of options. And the laser is kind of the last thing if none of those really worked. Especially for insurance purposes, you usually have to, if you want the laser to be covered, which often it's not, you have to document that you tried all of these things first. But yes, absolutely, we have that laser in the office. It works. There's a couple different lasers that work. And yeah, if you have one of those stubborn warts where you kind of tried everything and it's not working, definitely we can use a laser to treat that. That was a great question too. You guys had such great questions over the past 24 hours. I'm really just so impressed by them, and I'm so excited to answer them. Anyone else live? No, we're good? Okay. I got a question. Do you have to go to medical school to be a dermatologist? So yeah, absolutely. You have to go to medical school. You have to do college, then medical school, then an internship, which is medical school is 4 years, internship is 1 year, dermatology residency after that is 3 years. Then if you're going to specialize in something, you do a fellowship, which is what I did in lasers and cosmetic surgery. So it's a lot of school. Absolutely, you have to go to medical school to be a dermatologist. If you're asking because you're interested in becoming a dermatologist, please let me know. I would love to have you come in and shadow me and work with me and see how things are done. it is the best job in the world, and I couldn't be happier to treat all of you. So yes, that is absolutely a yes. You have to go to medical school to be a dermatologist. Please do it. You won't regret it. Hi, Christopher. Thanks for joining us. Hey, Samir. I haven't seen you in so long. Okay, so I can't say your name because they thought it was Siri. So good to see you, though. Can everybody hear me again? Good? Okay. Great. Hi, guys. So we will go down the list of the next question we got. How long does Botox last? Another great question. So another great question. You guys asked some good ones. So Botox specifically can last anywhere from 2 to 4 months. Some people are a little luckier and it can last maybe a little bit longer. Some people are less lucky, it can be a little shorter. It really depends on how your body metabolizes it. But we like to say about 3 months is what you can expect. And you can wait for it to wear off, and then you come back and you do it again. So most people do Botox anywhere from 3 to 4 times per year. Sometimes people need to do a little bit more often. Sometimes people can spread it out a little bit more. Again, you don't have to do Botox. It's not something that's necessary. So, if twice a year is all you can do, and in between you're going to be moving around, then I hope you guys can still hear me. Teresa, okay, is that because you can't hear me, or let me know? I'm going to keep going. Sorry for that. I didn't mean to have her, I don't want to say the name because it'll pick back up, but the Apple thought I was talking to it. So you do it as much as what works for you. I mean, everybody has a different budget. Everybody has different time constraints. The downtime for Botox is nothing. If you have a little bruise, that would be the most, but most people don't bruise. But that's about how long it lasts. Some people, it lasts a little bit longer, would be the answer. But roughly 3 months if I had to answer your question with just one answer. So I hope that answers that. If it doesn't, again, let me know, and I will elaborate on all the different toxins and how long they last, or neuromodulators. Hey, Lila, I'm so happy you're here. It's great to see you. So that would answer how long does Botox last. The next question I got, again, filler and Botox. These have been some great questions this week. So can you do filler, Botox, and laser on the same day? Very ambitious here, but yes, absolutely. I've definitely done all of those things in one day on patients. It depends where the filler is and what type of filler it is, but most of the time the answer to that is yes. The way you would do it is you would start with the filler, assuming it's a deeper filler, because after you do a laser treatment, you do swell, so it would be harder for your dermatologist, or your dermatologist shouldn't try to do the filler afterwards, because the shape of your face would be changed from the swelling, and where you would need to put the filler is obviously not as evident. So you would do the filler first. Most fillers actually have lidocaine in them, so they help you with the numbing, so it actually makes the laser more tolerable. Then you would do the laser treatment, and the last thing you would do is the Botox. That's assuming you're doing a full face laser. That's because you don't want to do laser on top of Botox. There's been some studies that show that the high temperatures can actually deactivate the toxin or cause it to spread to areas you don't want it to. So you don't want to mess with that. So when we do it, we numb you first, the whole face, if you're treating your whole face, then clean off to do the filler, then we do the laser treatment, and we finish up with the Botox. Under eye filler, I tend not to laser over because it is much more superficial, and I'm just not comfortable doing that. I don't think it's really worth rushing. Most of the time, if you have the time and you don't need to do it all in one day, don't. But most people come in and have one day to do all of this, and yeah, absolutely, you can do it all on the same day. It can be done safely. It just, you need to be with somebody who knows what should go before what else and what areas are safe to treat laser on top of filler. I hope that answers that question. If it doesn't, let me know and I can get into more detail. We'll keep going down the list of questions we got. Again, if you guys have any questions that are coming up as I go through this, feel free to ask them. I had another question about filler. Oh, can you dissolve filler? Great question. So most fillers that I use are dissolvable. So most fillers that we use, or most dermatologists use, are made out of hyaluronic acid, which is an ingredient we talk about a lot in our moisturizers. So what is hyaluronic acid? So it is a molecule that you have naturally in your body. It binds water, so it helps to keep your skin hydrated and smooth and dewy looking and plump. As we get older, we lose hyaluronic acid. However, the enzyme we have in our body called hyaluronidase that digests hyaluronic acid does not go down as we get older. So we have more of the stuff that eats away the hyaluronic acid, but less of the hyaluronic acid, which causes for dehydration of the skin and sagging of the skin and more fine lines to set in because of the loss of that structural support. So having a hyaluronic acid moisturizer is great because you replenish that. Using hyaluronic acid-based fillers is also helpful because it helps to build your own collagen again. Hyaluronic acid is necessary for the support of your skin. And it also will replenish volume where you used to have it. Now, hyaluronidase is the enzyme that you have that digests or gets rid of hyaluronic acid. We can actually inject that enzyme into areas where we put in filler in order to get rid of any unwanted filler. So yes, you can dissolve filler. There's a couple of different companies that make the solution that dissolves it. We use Hylenex. It's the same ingredient, it's hyaluronidase. And filler can be dissolved. If you get filler in your lips or something and you hate it, or your cheeks and you hate it, that's pretty much an immediate dissolving. We'll give it 7 days before we add more. It takes about that long for everything to go down, the swelling, but absolutely. Now, not all fillers are dissolvable, so those are just the hyaluronic acid-based fillers. Other fillers that are calcium-based or other ingredients are not as reversible. So a lot of, if you're iffy and you're not sure if you want filler in that area or not, you're just having some fun, stick with the hyaluronic acid-based ones. Talk to your doctor and see what he or she thinks, but that's the safer way of going for reversible. The other fillers are not as easily removed. And then someone asked me actually about silicone fillers. So silicone cannot be removed. It's permanent, and it's not really used that much anymore. It used to be used before we had some better options. So we don't really use that. Even the micro dosing, which you asked about, it's not something I use or most dermatologists still use. It's just not worth the reaction your body can have to it even many years down the line. Hope that answers that question. Again, if it doesn't, just let me know. Happy to elaborate. We answered the jaw. So I had a question on what laser can be used for acne scarring in people who keloid? That's also a great question. I can't get over how great these questions are this week. So keloids are when you have scar tissue that's thicker that forms in areas of trauma. Typically it happens in areas where there's high tension, the shoulder blades or the middle of the chest. The earlobes are a common area as well. Keloids are not as common on the face. Hypertrophic scarring is a little bit more common, but they can happen. So for acne scarring in people who keloid, I'm comfortable using the Fraxel Dual laser for that type of acne scarring. I would err on the side of using that as opposed to something like needling, which is a little bit more of a direct physical trauma. The Fraxel Dual is non-ablative, meaning it skips that top layer of skin and goes down deeper into the collagen to help remodel the scarring. And I find that to be very safe and done in a conservative way in people who keloid. So that would be, in my opinion, the best option given your question. There's lots of other options that can be used as well, even with the risk of keloids, and it's important to see where the keloids are, how many you have, and actually if there are keloids, they should also be treated. There's lots of options now to treat keloids that are quite wonderful and that work beautifully. So lots of studies going on actually for innovative treatments for keloids. So that's something to come in for as well. But to answer your question specifically, I would use the Fraxel Dual, tried and true, for people who keloid, and it works beautifully. So I hope that answers that question. We will keep going. No live questions, guys. Everything's good? Okay, we got the peel question answered, Dysport. Oh, so Maddie had a great question about men's skincare. So for my husband, is the question, what can I do to help him have a routine to help him age gracefully? Do men need different skincare than women? What a great question. So men have thicker skin at baseline. There's more collagen in their skin, so it is thicker at just that baseline, of course. And also most men shave at least a few times a week, and that's actually a nice form of physical exfoliation. So that actually, they have this regularly kind of, hi Carly, I'm so happy you're here. So they're shaving, so that's literally a physical exfoliation. They're shaving dead skin cells off their face or your face, men, with the razor, with the hair. So there's that, plus the addition of the at baseline thicker skin. So because of that, men actually need fewer products. However, because men are shaving, you do need more products that are sensitive to that. You know, the skin is more sensitive right after being shaved. So because of that, most of the products are simpler, but also have ingredients that are quite calming. So in order to make a routine for men, it's very similar to women, where we want the acids, we want the exfoliating, and we want the retinols, but we want them to be a little bit gentler in the sense that they're easier on open or recently shaved skin. So same idea, you want exfoliating. So if you're shaving 3 times a week, you're exfoliating, you're good there. You still want to have a glycolic or salicylic if you can, just because it does help to promote collagen renewal. So most of the time I just recommend the Neutrogena oil-free acne wash. It's a salicylic acid wash. It works great, and you can do that on the days you're not shaving. Retinoid is oil soluble, so greasy moisturizer makes it less effective. No, it doesn't. You don't want to put oil first if you're using straight oil, because that's just so occlusive. But if you're using a moisturizer, that's totally okay. You can put that on before retinoid and afterwards. Treatments for keloids, great, we'll talk about that too. Vivim has been used. So men, so my favorite line, if you just kind of want to stick to one line that has very men geared products, I would stick with Kiehl's. They have they have a morning cream or a serum called Facial Fuel that has vitamin C in it, green tea, and lots of antioxidants, as well as some SPF. So that's kind of a nice morning cream. You get your antioxidant, you get your moisturizer, and you get your SPF. And then at nighttime, Kiehl's has one called Midnight Recovery, which is a retinol-based serum that's gentle and also has some anti-inflammatory ingredients in it, so it's tolerable for people who shave often. So I love that. There's also a gentle cleanser called the Ultra Facial Cleanser from Kiehl's, which is great for both sexes. And that I think is a really nice regimen, because you get your exfoliating with the shaving and with your salicylic on the off days. You get your gentle cleanser at nighttime, and you get your retinol. I also really like another moisturizer by Aesop for men. It's called Aesop Seeking Silence. It's a facial hydrator. It's great for the winter time for men because it has lots of calming ingredients in it, lots of antioxidants. Comes in a jar, which means it's a cream, and it works beautifully. So in the winter time, I would up from the Kiehl's moisturizer to that one. Men who don't want to deal with the flaking and peeling of the retinol, or if they shave every day and it's a little too much to use a retinol, I really do like the Melatonin by Isdin with the bakuchiol for nighttime. It's vitamin C and bakuchiol and hyaluronic acid and melatonin, which is great for aging gracefully. So SPF recommendation, we're going to talk about that too. And a lot of men, I know this might not be something I should be saying on Instagram, but a lot of men do like the fact that it's black and gold. However, one of the best men's products, and even if you look it up for facials at home, it says good for men and women, and men, don't be scared of the pink color. Pink is a great color. Drunk Elephant Baby Facial is a nice way of incorporating a AHA, BHA once a week for men. So kind of shaving during the week is your physical exfoliation, and then once a week you do the baby facial. It sheds off that dead skin. Don't do it on a day where you just shaved. That's a nice way of making sure you incorporate a chemical exfoliant into your routine. It's wonderful, it's easy, goes on, it's 20 minutes, you wash it out, and you look refreshed. Exfoliating for men can also help alleviate or prevent ingrown hairs from shaving, so it's definitely something to incorporate. For men, this routine can be a little simpler. You want the moisturizer, the SPF, and the vitamin C. You want ingredients that have things that are calming, like the Aesop one, calming ingredients, because shaving can irritate the skin. You still want a retinol on board at nighttime, but if you shave every day as a man, it might be a little irritating, so you want to stick with the bakuchiol, which is a little gentler and also has anti-inflammatory properties in there. And that would be a nice routine for men. We do men's skincare routines all the time. We come on in, we check the acne, we check the full body. It's medical visit, and we go through a skincare routine to help men looking their best as well. The cosmetic from the cosmeceuticals industry for men has skyrocketed in the past couple of years, so it's nice to see men taking care of their skin and being more interested in things they can help to stay looking their best for longer. So Maddie, I hope that answers your question. If it doesn't, let me know. What do I think about oral collagen supplementation? Great answer. So we're building up some live questions I need to go through. What acid products like baby facial, BRP50 with retinoids be too much? So yes. So you don't want to use, so I'll start actually with that one and work my way up, I guess, since we're on that topic. So the baby facial is not something you want to use every day. You want to use that once a week. If you're doing a 25% AHA, 2% BHA mini at-home peel, that's a supplement to your skincare routine. It's to kind of help shed off those dead skin cells. In the spring and summer, we turn over our skin cells more often, so we do have more dead skin cells sitting on our face. So incorporating that is a great thing to do once a week. given you've already kind of been on a retinol and you've already been using your gentle chemical exfoliator during the week. If you're kind of jumping right into a new routine, that's not something you want. You want to introduce things slowly. All of these will make you more sun sensitive, so when you are using them in the summer, you absolutely have to stick with a good sunscreen. And Justin, I hope that answers your question, but it leads me right into my SPF question. Yeah, so the night, exactly, you use the baby facial. If you're doing it in that night, especially, you don't want to put a retinol on. You just want to moisturize and go to bed. That's the best way of doing it. Your retinol only needs to be used really every other night, so you can do the baby facial on like a Sunday night and then take that night off and then restart your routine the next day. Physical sunscreens are better in my opinion. Maybe they don't work better, but I think they do, and they last longer, and they're physical, and they don't cause heat on your skin. They don't exacerbate things like melasma or rosacea. So yes, if I had to pick, I would choose a physical sunscreen. I like zinc and titanium based sunscreens. I'm not sure who asked that, actually I wrote it down quickly. But my favorite physical sunscreens are the Isden sunscreen, the Ageless, the Elastin Hydratint, and Aveeno for the body, Positively Mineral is great. Elta MD is also great. They make both physical and chemical sunscreens, but those would be my favorite sunscreens. Neutrogena also makes a great one. It's called Age Shield. It's SPF 110, which is high, and that's not purely physical, that's chemical as well, but it does work. Chemical sunscreens aren't bad. There's more data coming out that show that those chemicals in our bloodstream, we don't really know. So I'm erring on the side of caution and just use physical sunscreens because we know that they're zinc, titanium, they're mineral based, and they're safe and easy to use. And now that they're tinted for the face, it's even better. It's kind of like skips the step of having to put any foundation or makeup on. It's great. So I hope that answers the SPF question. If it doesn't, let me know. Trista, what do I think about collagen supplementation? I think it's great if you're using a good one. So not all collagen supplementation is created equal. You want to use something that has some clinical studies behind it. A lot of people are taking HelioCare as well, and there's actually some great supplements now that have both the HelioCare, which is sun protective, plus collagen, plus other ingredients that help with hair, skin, and nails. So if you're going to take it, I think, just take one that has been shown to be effective with real science, like Nutrafol, for example, has tons of collagen in it. It's great for hair health and hair growth. And it has the collagen, which is great for your skin as well. And it has hard science showing that it works. A lot of the collagen supplements you'd see that are like shakes and things. Some of them are great, some of them are not. Some of them are really mostly just sugar and they just taste good. So I always recommend using a medical grade one. But yeah, you are what you eat. We've said that before. So if you're taking collagen and you're supplementing that in your body and with a digestible or absorbable version that's going to help, it's a great addition. I personally have started recently taking the Sun Isden HelioCare that has collagen in it as well. I've already noticed the difference, to be honest. I love them. And they look like chocolate, which is fun. I mean, you don't chew them, but the fact that they just look like little chocolates, it gives you that little, oh, I think I got some chocolate today, happy feeling. So it's nice. I hope that answers your question, Tristan. Do you think skincare brands from dermatologist's office are better than drugstores such as La Roche-Posay Vitamin C versus SkinCeuticals? Depends on the product. Great question. So some products, yes. So if you're looking for just a hyaluronic-based moisturizer, the Neutrogena gel cream is awesome. The Hydra Boost, tons of hyaluronic acid, absolutely will moisturize and replenish your skin with that hyaluronic you're looking for. And no, you don't need to go spend $200 on HA5 from SkinMedica if it's not in your budget, and even if it is. If you're looking for things that have peptides in them or antioxidants or things that can go bad, then you do want to get a medical grade product. For example, vitamin C serums over the counter or rather at drugstores, a lot of them, when you open vitamin C, if it's in a water base, it can oxidize, meaning that there's a ticking time, there's only a certain amount of time that it's still effective after you open it. So let's pretend this was just all vitamin C and I opened it and I used it and I put it away. The rate of oxidation determines how long it's going to be effective for. So the ones I like for example, we get from Isden are these little ampules. So I know that I'm going to finish this ampule within a week. So I know when I break it open and I start using it, it's not going to go bad. And relative to stuff you can get at the drugstore, this vitamin C You get 30 of these guys in a box for about $85, maybe $90, and that's 30 weeks worth, which at the end of the day ends up costing you less. And there's science to show that it works. They have unbiased studies. SkinCeuticals is an expensive vitamin C. I love it. It works. It's medical grade. It's high potency. It is water-based, so it does oxidize, although they have some other stabilizing factors in there that help with that. But if you want one that's medical grade, that's non-water based, that won't go bad, the PCA one, PCA Skin makes an anhydrous one, meaning that it's not water based, so that one won't go bad in the same idea. And it's one of the highest concentrations of vitamin C on the market. So for those things that can kind of oxidize or go bad or lose their efficacy, you want to stick with the doctor's office. What's your opinion on prescription HA? You don't need a prescription HA. That's my opinion. Over the counter is totally fine. That's not worth it. For retinols, you can get over the counter. They're just weaker than prescription strength. And the medical grade ones tend to be a little bit easier on the skin, where they have ingredients in them that make them a little easier to handle, with some soothing components so that they don't irritate your skin as much. But retinols that are like the Neutrogena Rapid Wrinkle Repair are great. So that is my answer to that. So some things yes, some things no. It's a good thing to discuss with your dermatologist. Which ampules were those that you recommend? These are the Isden Flavo C ampules. So when you go to look them up, they're on Isden. There's a discount code, ISDEN-MD0008. It gives you free shipping and 10% off. I think it's still going on. They make a larger version of this that's called Flavo C, but it's a big one. That one is a non-water-based one. So if you wanted just one big one that's non-water-based, this is a good one. I like theirs because, get this, Justin, there's hyaluronic acid in here. So it kind of kills two birds with one stone in the morning. You wash your face with your salicylic glycolic, and then you put this on and you get your hyaluronic acid and your vitamin C in one step. I still moisturize afterwards because I like a moisturizer, but this is very moisturizing. And my moisturizer has even more antioxidants in it than just vitamin C, so I kind of get like this whole big dose of antioxidants, and I love it. It makes me happy, but you don't need both. But that's my favorite, vitamin C. And yes, for some of the things, you do want the one from the doctor's office. For other things like hyaluronic acid or retinols, or things that are just pretty stable, you can just stick with what you're comfortable buying at just a regular CVS or Rite Aid. And I have a whole list. I have actually this whole Excel spreadsheet about what you can get at Sephora, what's worth it, what isn't worth it, what medical grade is necessary, and I go through that with everybody. It's even color coded. So I love doing that, and there's lots of different options out there. I hope that answers that question. Let me know if it does not. So we answer the SPF, the collagen. Oh, keloid treatments. So there's lots of different things we can use for keloid treatments. It really depends where the keloid is. The first round, or the first thing we do, is injections with something called Kenalog, which helps to soften the scar tissue. More recently, we've been doing studies to see if botox works, or different neuromodulators, which has been shown to work nicely actually for certain types of hypertrophic scarring, not necessarily keloids, but other thicker scars. We use something called 5-FU, which is an injectable medication that helps to minimize the appearance of keloids. It really all depends on where it is. A lot of the time you can't remove them because they just come back worse, but sometimes you can, so especially in the ear and things like that. So different things are out there, different injectables and different treatments. V-beam has been used and does seem to work, but you can also trigger it because it is a form of trauma. So you really need to look at the color, where it is, what you've tried before, and what the best options are for you. Vitamin C works better when skin is more acidic, so I should use an acid toner with vitamin C. Does salicylic acid make your face? You're nailing it. So I always say, most of my patients rather, their morning routine is to wash with their glycolic and salicylic wash, pat dry, and then put on their vitamin C. Not only does that create a more acidic environment, but it also sheds off a ton of dead skin cells so that whatever you put on afterwards can penetrate better. So that's a great way to do it. So I'm not the biggest fan of toners. I think that you can get your acids with washes, although some people love toners. But most of the time, I don't recommend toners unless you're just doing it because you like the way it makes you look. It's definitely an immediate, nice, softer look. But if you're washing with a AHA, BHA wash, you don't need to also do the toner. I hope that answers that question. You've got some really good questions. I should just have you send me all of them. It's amazing. But yeah, you know your stuff, and yes, I do the wash first and then the vitamin C. Okay, we will keep going down the list. We are almost done with the questions I actually got over the past 24 hours. So if you guys have any questions coming in now, feel free to send them in. Now's the time. I think we have 15 minutes left before they cut me off. We answered, oh, I got another question. What is the CO2 laser? Great, Justin, of course, you're welcome. So the CO2 laser is a specific type of laser that uses carbon dioxide, CO2, as the energy source. And this is an ablative laser, meaning it goes through all layers of the skin. This laser is mainly used for severe acne scarring, skin tightening, and skin rejuvenation. That helps to reduce the appearance of fine lines. It helps tighten the skin. In fact, I have like a little mark here because I actually just did one, total honesty, around my eyes to help tighten the skin around the eyes. I did it last week. I'm healed nicely. If you see some marks, that's what it is. It causes some scabbing. But it's a laser that goes through the skin and destroys old, more crepey skin and allows for newer collagen to form, and it tightens the skin because of the heat source. Works beautifully. You can do it mostly anywhere on the body. You have to be careful when you do it on the neck. But it's a very effective laser for acne scarring. Hey, Nicole. Oh, I'm so happy you're here. Guys, she's the best. So it helps to resurface acne scarring, which I've done it for. Lots of patients on myself as well. Tighten the skin around the eyes, tighten anywhere where there's kind of loose skin, stomach, other areas. It really depends what we're treating. So the chest is a common area. It is not a laser without downtime. You are definitely scabby for about a week, then you're peeling, and then you're pink for quite a while after that. It's also not a laser for all skin types. If you have darker skin type, even my skin type is actually pushing it, but I was very conservative with my treatment. You have to be careful because of the risk of hyperpigmentation, and you definitely have to plan to be careful afterwards if you're going to be outside. Obviously, the summer's not the best time to do it. It's just the best time for me to do it, given my job. But you have to wear a hat, sunscreen. Hey, Dave. Oh, it's so good to see everybody from medical training. And you have to be careful, and you definitely want to see somebody who is a laser expert. This is not an easy laser to learn how to use, and it's not an easy laser to use safely if you haven't been trained. It's one of my absolute favorite lasers. It can be used for lots of different things: wrinkles, acne scars, skin tightening, skin laxity, eye lift, eye tightening, and it's wonderful. So that answers, I hope, that question. I think that was Stephanie. If I didn't answer it, let me know. I can get into more about it. It's also fractional. We've gone over what fractional means, where things are kind of like that, and the laser skips some areas to leave some normal skin behind or some untreated skin behind to help you heal faster. The old CO2 many years ago used to be fully ablative, or meaning that it wasn't fractionated. It was just completely, the whole area of skin completely would just be taken off. That had a higher risk of infection and much longer healing times. So we don't really do that anymore, although we do have that option in very specific situations. So I hope that answers the CO2 question. I'm just checking. I think that might be all of the questions we actually got. We answered the men question, Botox, lasers, all on the same day, lasers for scarring, collagen, SPF, keloids, hair. That is all the questions I actually got, guys, for the past 24 hours. That's right, somebody sent me a message. It wasn't a question, about kind of like my favorites, just like, boom, what's in my makeup kit for everyday makeup. This is a follow-up to last week, right afterwards. I know we had gone over what I use for makeup. So like I said last week, you want to use lighter makeup. So I'm just going to show you kind of what's in my everyday makeup kit. And you guys know my routine. So I do my wash, I do my vitamin C, I put on my moisturizer. In my makeup kit, I actually keep my Isdin Ageless. It's the tinted sunscreen with the DNA photolyase in it, the DNA repair enzyme. So I put that on, and that's essentially like my foundation. It gives you a nice soft appearance. It's very light and easy. And on most days, at least in the summertime, that's all I use. Yeah, we're going to talk about an eye cream in a second. There's one that is worth the investment. After that, if I do want more of a makeup look, I do have this, we went over last time, the Hourglass Illusion Hyaluronic Skin Tint. So this has SPF 15 in it, so it's like a double layer. This is 50 and this is 15, not that I need both. And this one's non-comedogenic. It's basically like a CC cream in a lot of ways, but I think it blends in really nicely and I love it. After that, I'll just do a highlighter, which is also Hourglass, and a little bit of blush. And then I'll do my mascara, which I use the Shock by YSL. I think it's great. I've used it for many years. It definitely doesn't, you don't need an eyelash curler when you use this. It's just a great mascara, and it doesn't irritate the eye or drop underneath. And then if I'm going to do anything else to look a little nicer, I'll use lipstick, and sometimes I'll use the Charlotte Tilbury just little like brown eyeshadow for a little shadowing look. Eyeliner wise, I don't really wear eyeliner every day, although I do have one in here. It's a dark green one by 17 Cosmetics. It's awesome. So if you have dark eyes, just so you know, if you use like a gray or green, dark green eyeliner, it can actually make your eyes look bigger. So I use that when I do eyeliner, not that I don't often wear it, but and then for eyebrow, just contouring, I use the Hourglass brush. That is everything in my makeup kit. So that's kind of like my everyday makeup kit for weddings and things like that when we have those again. I do have more eyeshadows and lipsticks in like my vanity, my desk, or my vanity table, but this is like my everyday, bring this to work, doing makeup at work kit. I hope that answers that question. I also keep all my nail polish in there in case I have chips, so I fix that at work too. So that's all in my makeup kit. And this is Essie. It's called Hot to Try. Ooh, what a nice name. So that's my makeup kit. That's my go-to. So I hope that answers that question. If it's not helpful, let me know. All of that is really easy to find at Sephora or just online. Okay, eye cream. Any eye cream is worth the investment, absolutely. So it depends what you're looking for. So if you're looking for dark circles or puffiness, a vitamin K based cream or anything that's green tea or resveratrol based that's calming is a great eye cream investment. I like the Isden one. Neostrata makes a great one. So does Neocutis. Those are all great. My all-time favorite eye cream, I think everybody asks this every week, and it's a great question, is the Elastin Restorative Eye Treatment. Again, this is not an inexpensive eye cream. It is expensive. I think it's like $95. However, it is one of very few eye creams that has been shown to work on both the upper and lower lids as well as the crow's feet as an eye cream. So not only will it thicken the skin under here and minimize the appearance of dark circles as well as fine lines, what's nice about it is when you do like one little pump and you get about that much. And from that one pump, you actually go 1, 2, 3, 4, and that one pump is enough for both eyes, and you kind of just rub it in, and it works really nicely. I did have makeup on that little scab for my laser, but that's okay. So that's it. This is my favorite eye cream. I've used it religiously. After a few weeks of using it, you really do notice a difference. I was considering doing under eye filler at one point, but after I started using this, I really don't think I need it anymore. So it definitely restores collagen. It uses trihexpeptide, which is a peptide that helps thicken the skin and renew collagen. What's your opinion on high-end products like La Mer or SK2? If you're gonna get a high-end product, get a medical grade product. La Mer is even more expensive than some of these products that have real science backing them. In fact, there was once a head-to-head study of La Mer versus the Hydra Boost as far as moisture goes, and Hydra Boost won. I'm not bashing La Mer. I think I got one as a gift here, and it's here. It smells great. It's really nice. It works. But if we're talking, cost effectiveness, I would stick with the medical grade products. You're going to get definitely the most bang for your buck there. Or like a drugstore hyaluronic acid like Neutrogena is fine. You don't need to splurge on products like La Mer. SK2 is actually a pretty good line, and their stuff is less expensive than La Mer, and their stuff is pretty good. But again, some of these are great, and they're probably just as good as some of these medical grade products in a lot of ways if they were studied, but these products have science, real clinical data that's unbiased showing that they work. So if I'm going to spend the money, I'd rather spend it on something that has real proof. So that would be my answer to that. No, you don't need to splurge on those high-end products for the basics. And for some things, it's worth splurging on medical grade, but I don't think it's ever truly worth splurging on those type of products unless it's a gift card or somebody got it for you and it's there, you can absolutely use it. I hope that answers your question, Justin, to be completely honest. I don't have any of those here. I think I got La Mer once as a gift. I'm not even sure if it's still here. No, it's not. I must have used it. So no, I've never really just bought that for myself. Good, I'm glad I answered the eye question. Justin, I hope I answered your question. What's a good moisturizer you would splurge on? The Elastin Ultra Nourishing Moisturizer, absolutely. The Skin Medica HA5, absolutely. The body moisturizer, that's not even really a splurge. I think it's like $30. I love this. It's the Uridin. Hey, Sydney, I'm glad you're here. Lotion 10. My skin has never been softer. This is an amazing body moisturizer. I really think it's only like $30 or $40, so it's not really too much of a splurge, but it's still a splurge for, when you can get something for a lot less at the drugstore. Definitely worth splurging on. Absolutely love it. It helps soften skin, especially on the elbows and knees. It has some urea in it, which is why. But face-wise, to splurge on, the Elastin Ultra Nourishing would be my number one. I think it's like $55. And the Isden makes another one too, the Age Contour. It's tightening for the lower face. And that would probably be my answer for that. I hope that answers that question. I actually, you just reminded me, I got a question for after laser procedures, what to use. My favorite post-laser treatment would be the post-treatment aftercare by Neocutis. So soothing. I'm using it on myself around my eyes. It doesn't break you out like a lot of more oily ones do. It works so nicely. I know it looks tiny, but just a little bit goes a long way. So this is my favorite post-treatment soothing cream. A lot of people also use the Elastin Regenerative Nectar, which is much more expensive. This is over $200. I really like this one a lot. It's creamy. This one's greasier and is one that you want to use before and after your procedure because it does take time to clear out some of the dead skin and help you heal afterwards. We did do a study on this that shows that it reduces your healing time, which is a nice plus. But my favorite one would probably be this one, followed by this one. I hope that answers that question. Those are, again, all the questions I got over the past 24 hours. And I think if I skipped any of you guys, just let me know. I hope I answered everything that came in live. I mean, we got amazing questions over the past 24 hours. And even tonight, I'm so impressed by your questions. I really am. I love answering them. And everyone is so smart and asks such great questions. So it's my pleasure to answer them. How do you feel about organic essential oil focused brands like Tata Harper or Ame Lindstrom? So those are, I like them because they're gentle and they are organic and they definitely are good for your skin. They're, again, a little pricier because of that, but yeah, I love Tata Harper. I mean, it's a great brand. I like Tatcha. I mean, there's different, Alba Organics is a great organic brand. Wolita Skin Food is one of my favorite moisturizers. You can get it on Amazon. It's one of the ones that's safe to get. It's $18. And it's totally organic and it works beautifully. So a lot of those organic or essential oil-based ones are wonderful. You just have to find what works for you. A lot of the time, the oil-based products are not. You're welcome, Poonam. I'm glad you joined. A lot of the oil-based products are kind of comedogenic, meaning they can cause acne. But if you're not acne prone, go for it. The marula oil that comes with the Drunk Elephant baby facial is awesome. I love it. So it really depends on your skin type. And if you like it, go for it. Use it if it's essential oil and it's soothing and it's rejuvenating, it's great. If you use Skin Food before, yeah, that's very thick. So I usually have that people use that in the winter when they're on a retinoid, and we're starting a retinoid in the winter, which is hard to do. It's kind of like an every other night, they'll use it to just repair the skin. It's incredibly thick, but it serves a purpose. So yeah, organic brands are wonderful, and they're good and they're clean and they're helpful if they're targeting what you're looking for. Things that have like pumpkin spice in them, or pumpkin enzyme rather, not pumpkin spice, are great. You know, it's a nice way of introducing an antioxidant. So it's a great discussion to have with your dermatologist. All right, I hope I answered everyone's questions. I'm getting a warning from Instagram that we are in our 2-minute mark. So if you guys have any questions you didn't think of tonight, please message me. Last week I got a few messages after the live and I answered them this week, so I would love to hear from you. Again, Mondays I'm here for you guys. I love doing this, and it's one of my favorite parts of my week. So thank you for joining me. Oh, why do some products, when mixed together, ball up? It's the order you put it in. Again, good thing to go through with what you're using, what goes first, what goes second, what doesn't mesh together based on their consistencies. You've got some good questions. I wish you could just send me all of them because I will never run out of questions ever on lives. But yeah, you have to go in the right order. So we have just a few seconds left before it cuts me off. Thank you guys. I look forward to seeing you next Monday. And I hope everybody has a great 4th of July weekend. Stay safe and healthy. Wear sunscreen, whatever it is. The one you have is the best one. Just use it. Make sure it's SPF 30 or greater. Wear a hat. But enjoy yourselves. And I hope everybody has a great week. Great to see you all. Thank you so much. And I hope I get some more questions from you guys for next week. Bye.